Hello everyone, my name is Happy Amwa, an MPH student at Liberty University. This video is about my interprofessional volunteer learning experience as a remote COVID-19 case investigator with the Partners in Health organization. So my job basically involved contacting laboratory confirmed and suspected diagnosed cases of COVID-19 via telephone. We conduct interviews with patients or persons to help us gather more information about the symptom history, the source of illness, or where the patient could have been potentially being exposed. And also we try to find out the activity history while they were infectious to better help us trace contacts. So prior to starting my service experience, I received training from the supervisor as well as the team lead on conducting telephone-based interviews, HIPAA regulations, as well as collecting and entering of data. So I worked collaboratively with a team of 4 other individuals who were equally trained in their various specializations in discharging our duties. These individuals included one other case investigator whose name is Roger. So together we conducted interviews on the laboratory confirmed cases using the contact information provided us by the laboratories. We ensure to provide health education and guidance to COVID-19 positive patients who have been exposed to help prevent the ongoing disease transmission process. And then we also help them to effectively isolate at home, as well as ensure they had adequate supply of basic needs to help them properly isolate. Now, Rachel was the team lead of my team. She directed the affairs of the team. She trains and then she continuously assesses case investigation and contact tracing teams. She collaborates and coordinates with a team of public health professionals and also informs the team supervisor when communication attempts fail. Also on board was Kelly Bean. Kelly Bean was our team supervisor. She was in charge of ensuring that all aspects of the program and problems encountered were addressed in a timely manner. She also discusses challenges with the senior management team and helps us identify solutions to better solve the problem at hand. Also on board was the senior management analyst. She happens to be bilingual, speaks both Spanish and French. She directs the personnel in performing administrative duties. She also acts as a staff advisor to management. She also conducted evaluation work schedules and prepares reports, as well as finding alternate methods for outreach if phone contact fails. Now, the diversity in the background of my team made us a formidable team, which helped us in achieving our daily set target of being able to reach at least 8 cases daily. Now that brings me to the main focus of this video: what makes a good interprofessional service member for public health. Now, throughout the program, we learned about what a team is about, team approach, and everything. So I would say a team is defined as a group of people working together to achieve common purpose for which they hold themselves mutually accountable. So what makes a good team is the ability to collaboratively work together, enjoy working together in a spirit of harmony and trust, with shared responsibility for producing results that is geared towards achieving the team's goals or organizational goals. So then, in my opinion, to be a good interprofessional service member for public health, one must be a good team player, must be able to focus and contribute towards achieving or even exceeding the goals set by the team or the organization, also have respect for each team member, and build on each other's strengths and weaknesses. In my service experience, I was guided by some of the competencies listed in the Public Health Foundation core competencies, as well as those outlined in the MPH program. So on reaching the cases when you call, first of all, we verify patient identity before we before we proceed to release any confidential information. Now, doing this needs communication skills. Communication skills falls under competency number 19. Now, to be able to communicate effectively, you need to develop a warm, empathetic rapport with the patient, which is paramount to having an um, effective interview session to be able to collect accurate information. Now, being able to accurately collect information helps you to actually know what the patient's needs are. Now, assessing the patient's needs also helps us to further refer patients who need referral services. For instance, people who need services in providing food, transportation to get their tests done, and a whole lot of other needs that individuals may have. And so being able to listen effectively and assess the patient's needs falls in line with competency number 19, which is communicating audience appropriate public health content both in writing and through oral presentations, which we do via the patient education. Now, the third competency is leadership and system thinking skills. My team also worked collaboratively and coordinated with a team of public health professionals such as surveillance coordinators, surveillance triage, support staff, contact tracers, care resource managers, epidemiologists, and clinicians as well. So being able to efficiently obtain the social demographic information being provided by the laboratories is also in line with leadership and system thinking skills, since we are working collaboratively to achieve a common goal. Also, when we call our patients, we ensure cultural competency is observed. In doing so, we respect the diversity of patient population, cultural factors such as language, communication styles, patient beliefs, attitudes, and behaviors. Prior to beginning the case investigation, we made sure to ask clients which language they prefer to speak, and then we provided services as such. Now, this falls in line with competency number 20. Again, we made sure to abide by HIPAA regulations, therefore ensuring patient confidentiality of information. Now, we also used a bit of community dimension of practice, because as we interview these cases, we are able to help them identify places they might have been at their time of exposure, and then we coach and guide them and also agree on how to prompt contact. Now, in summary, I would say working with the team was a very pleasant learning experience for me, even though it was a remote one. My team members were very supportive and very encouraging as well. Now, being able to work collaboratively on the team gave me an opportunity to help my community by helping reduce or prevent the ongoing transmission of the pandemic, as well as fulfill competency number 21, which is to perform effectively on interprofessional teams. Thank you so much for listening. Once again, my name is Happy Amwa. To be a good public health member or team member, you need to give in your all. Love the community and love what you do. Thank you.